Hello friends. Let's explore conjunctivitis, often referred to as pink eye. We'll delve into its symptoms, signs, various types, methods of diagnosis, treatment options, preventive measures, and dispel some common misconceptions and myths. Conjunctivitis means inflammation of conjunctiva. What is conjunctiva? What is infection and what is inflammation? Let's explore this. The human eyeball is a spherical organ. Towards its front, there is a clear transparent structure known as the cornea. However, over 80% of the outer surface of the eyeball is enveloped by a white layer called the sclera. The sclera extends from the cornea and connects with the fibrous sheaths of the optic nerve. The eye socket, medically referred to as the eye orbit, is the protective bony cavity that provides a secure space for the eyeball to reside within the skull. Indeed, my friends, when you gaze into someone's eyes, those eyes are indeed spherical. Eyeball, also called as globe or bulbous oculi. Friends, please direct your attention to this image to better understand how the eyeball is positioned and accommodated within the protective eye orbit or sockets. Eyelids are, in essence, two folds of skin. These folds are known as the upper or superior eyelid and the lower or inferior eyelid. Their primary function is to safeguard and protect the eyeballs. Excluding the cornea, the portion of the eye that is visible to you, known as the visible sclera, is covered by a transparent membrane called the conjunctiva. Moreover, the conjunctiva extends not only on the visible sclera but also behind the upper and lower eyelids. The layer or membrane of the conjunctiva that is on the sclera is referred to as bulbar conjunctiva. By the way, another name for the eyeball is bulbous oculi, and for the eyelid, it's palpebra. So, the conjunctival layer on the eyelid, namely the palpebral conjunctiva, is where the bulbar conjunctiva and palpebral conjunctiva meet, and this meeting point is called the fornix. There are both superior and inferior fornices. Please pause video to see images in details. Infection and inflammation. Let's understand the difference between the two. The human body can be compared to a fort, castle, or fortress, constructed from bricks. Similarly, the human body is built from cells. When microorganisms, such as bacteria, viruses, or fungi, launch an attack or invasion on the body's cells or tissues, we call this an infection. Exactly, here you can see that the human body, which is made from cells, becomes vulnerable to the entry and attack of microbes within these cells. Inflammation is characterized by 5 classical signs: pain, heat, redness, swelling, tumor, and loss of function, which means that tissues or organs may not work properly. It's important to note that the term tumor has 2 meanings. In the context of inflammation, tumor refers to swelling, whereas in the field of neoplasms or cancer, it carries a different meaning. Here's a short story for you. Imagine a fortress, much like the human body, with one part of it being attacked by tiny invaders, just like the hand in the picture attacked by microbes. This is what we call an infection. Then, in that specific area of the fortress, or the local area of the hand, defense cells are activated. These defense knights or soldiers fight against these invaders, calling for reinforcements. The blood vessels in that area dilate, allowing increased blood flow, leading to redness. More help arrives, and this is inflammation. During the battle between the soldiers and the invaders, the area becomes red, swells up, loses some of its function, and yes, there is pain. These are the 5 classical signs of inflammation. When there is inflammation, we add itis at the end of the word. Like inflammation of the appendix means appendicitis, inflammation of the joints is arthritis, inflammation of the bronchial tubes results in bronchitis, and so on. Now, you tell me, in the comment section, what would you call inflammation of the lungs? Inflammation can occur due to infection or other foreign bodies as well. If there is inflammation of the conjunctiva due to germs, infection, or some irritant, we call it conjunctivitis. Now, can you tell me in the comment section, what are the classical signs of inflammation seen in conjunctivitis? Give it a try, it will be fun. Conjunctivitis can occur due to infectious or non-infectious reasons. Non-infectious causes include allergens like perfumes, fragrances, or pollen. Things that can irritate the eyes, such as contact lenses, shampoo, cosmetics, dirt, smoke, or chlorine in swimming pools. Autoimmune conditions can also lead to conjunctivitis. In babies, it might be due to obstruction of the nasolacrimal duct, foreign bodies, dry eye syndrome, or reactive arthritis. Infectious causes involve viruses, with adenoviruses being responsible for 65 to 90% of viral cases. Other viral causes can include COVID-19, herpes, enterovirus, and more. Bacterial causes include Staphylococcus aureus, Streptococcus pneumonia, Haemophilus influenza, chlamydia, and others. Conjunctivitis can be transmitted from one person to another through fomites. For example, if you have conjunctivitis and you touch your eyes and then touch a book, a doorknob, or any object, that object is called a fomite, and germs can spread from person to person through these fomites. Let us talk about types of conjunctivitis. It may be classified according to causes, for example, allergic, bacterial, viral, chemical, or autoimmune conjunctivitis. Extent of involvement means apart from conjunctiva, which surrounding structures are involved. Inflammation of conjunctiva along with inflammation of eyelid is called blepharoconjunctivitis. If cornea is inflamed along with conjunctiva then called as keratoconjunctivitis. And when eyelid, conjunctiva and cornea are involving then called as blepharokeratoconjunctivitis. Signs and symptoms of conjunctivitis. In almost all types of conjunctivitis, you will experience pink eye, or redness of the eye, swelling, and watery eyes. These symptoms are common. In viral and allergic conjunctivitis, you may also notice itching of the eyes along with watery eyes and swelling. However, in bacterial conjunctivitis, in addition to redness and eyelid swelling, there may be a sticky discharge. Due to this sticky discharge, the eyelids can stick together, especially after sleep, and you may feel a foreign body sensation in the eyes. Apart from these, there are other types of conjunctivitis, such as pseudomembranous conjunctivitis. In this type, a false membrane, known as a pseudomembrane, forms. This membrane doesn't remain true but rather consists of a collection of dead cells and inflammatory debris, among other things. Pseudomembrane conjunctivitis can be caused by Staphylococcus aureus and Corynebacterium diphtheriae. Angular conjunctivitis occurs near the canthus of the eye, where the upper and lower eyelids meet at that corner. Causes may include Morax Axenfeld bacillus, Staphylococcus aureus, and others. Hemorrhagic conjunctivitis is a type where bleeding occurs along with conjunctivitis, resulting in small spots or patches of bleeding on the conjunctiva. Epidemic hemorrhagic conjunctivitis is also referred to as Apollo conjunctivitis. Chlamydia conjunctivitis, if not properly treated and if the infection persists long-term, can lead to corneal ulcers and even vision loss. Diagnosis is based on signs and symptoms, medical history, examination, eye discharge, and in some cases, allergy testing. In severe cases, swab culture is also performed. Treatment. Viral conjunctivitis typically resolves on its own within 1 to 2 weeks. Artificial tears can be used for comfort. In bacterial conjunctivitis, topical antibiotics like moxifloxacin or ciprofloxacin may be prescribed, while for allergic conjunctivitis, antihistamines can be used. Don't self-treat. Consult your ophthalmologist. Some people self-medicate with eye drops containing a combination like ciprofloxacin and dexamethasone, but understand this. While steroids can provide fast relief, they also come with potential side effects, such as raising intraocular pressure or causing a posterior subcapsular cataract. If necessary, your doctor may prescribe a mild steroid like loteprednol. Most of the time, oral medication is not required. Prevention. Maintain good hand hygiene, avoid touching your eyes frequently, and keep your surroundings clean, like keeping your room dust-free. Let's have some questions for you. 1. Does looking at the eyes of someone who has conjunctivitis cause you to get conjunctivitis as well? 2. If you have conjunctivitis, Should you avoid using a mobile phone or laptop screen? 3. Should you stay in a dark room? No friends. These are all myths. Due to the need to keep the video short, it wasn't possible to cover everything about the topic. Still, efforts were made to include as much as possible. If you liked the video, please like and subscribe. And thanks for watching. Please let us know in the comments section what topic you would like for the next video.